With us now is Dr. Bryan Forley, and we're going to be talking about all types of cosmetic procedures, and also something that he does that's really philanthropic that just warms my heart. Joining us now is Dr. Bryan Forley. Welcome to the show. How are you?
Thank you, Donna. Thank you for having me.
One of the things that I learned about you in my research is the fact that you help children that have cleft lips and things of that nature. Tell us why you decided to volunteer in that way and what the process has been like for you.
Well, I think that the skills that we obtain during our training and in clinical practice has been very beneficial for the patients that we encounter on a day-to-day basis here. But then there's a whole other population in the world that don't have access to the opportunity to pursue correction of some defects that they might have been born with. And oftentimes in these societies, it can have a very detrimental effect on their ability to find work or even to leave the house. So I had the great opportunity to visit on 4 different occasions, actually twice in Peru. I went to Micronesia and as well in the South Pacific. And it's been an opportunity to utilize my skills to help those who have cleft lips, cleft palates, that they're born with in a timely way so that they can then grow up and be a productive member of their society. There was one individual I recall who was 35 years old, had a cleft lip, and had never been able to find a surgeon to repair it. And so he was operated on by us, and he couldn't stop smiling because it was truly life-changing for him. There was another 3-month-old whose father brought him to our hospital where we were working, and this was in Peru. And I remember when we left, he approached me as we were on our last day, and he looked me in the eyes, and in Spanish, but I understood exactly what he was saying. "My son will never forget you." And it's moments like those that make me want to keep doing this type of volunteer work. I was most recently in Palau, and these are island nations where they really have no access to surgeons who can fix some of these problems, and they have a proportionally high rate of birth defects because of various reasons, whether it's inbreeding or genetics or nutritional factors. There's a host of reasons
why.
But by doing this, I think it makes a big difference. Even in just one person's life, it's worth it.
One of the things I learned, I think it might have been in biology class, possibly in high school, is that the way that your face is formed is that it's 2 flaps, and then they're supposed to close together, like in the midline. Is that correct?
Well, it's a little more complex, but that.
Okay, well, it wasn't in medical terms,
but you're correct.
Right. Okay.
You're correct. There's movement of tissues, and sometimes if they don't blend or join, then you can have either a cleft. It can be in the lip, in the palate, but it can also be in the skull. There's sometimes deformities that are more advanced, sometimes premature closure, where the skull actually closes and the brain doesn't have room to grow. So that's in a whole nother set of operations. But I think dealing especially not only with children in these countries, but also adults who many times their homes, they're cooking over open fires, and they oftentimes will develop burn injuries that result in scar contractures. And these scar contractures can have a very functional limitation on their ability to work, to just live day to day. And sometimes a simple scar release or skin graft or different opportunities for dealing with these contractures, again, can have a complete life-altering impact on them. And so these were some of the other things that we were doing. And the opportunity was also there to train some of the local surgeons in some of the techniques. So it wasn't just a fly-in, fly-out mission. Part of our goal is to educate some of the surgeons locally so that they can maybe not do some of the advanced techniques, but at least have an impact in a way that is extending beyond our visit to the location.
Well, speaking of advanced techniques, one of the things that you were telling me about in the green room was that you're emulsifying fat and using that. So tell us about that technique.
Sure. So traditionally, surgery has been something that we have used for aging issues in the face and also for volume filling, for volume replacement. But most recently, we've been focusing on the qualitative aspects as well in terms of trying to alter some of the inherent aging issues with collagen, with elastic fibers, with skin tone and quality that aren't really addressed effectively with surgery. Surgery is more quantitative. We lift, we tighten, we remove tissues, we resuspend fat pads that have been sagging, but the quality of the tissue is not affected directly by surgery. And that's where some of the newer techniques, something called nanofat, where we emulsify fat to create a concentrate of growth factors, of stem cells, of something called stromal fragments, which have been shown to enhance the quality by triggering an improvement in the collagen, in the elastic fibers, in the tone, and in many cases, the appearance of the skin, even fine lines and texture, can be enhanced. And so this is an adjunct to some of the surgical measures that we're using, and I think is going to become increasingly popular over the coming years.
It sounds exciting, new technology. And speaking
Yeah.
of technology, the other thing that your practice has is you have a 3D technology. How does that work?
So 3D imaging has been a useful tool for me because it helps to enable the patient to visualize some of the changes that we discussed during the consultation. Many times we can talk in the abstract about what certain interventions, for example, in the nose might achieve, or a certain type of enhancement of the breast with certain size of implants or dimensions of implants. And it's always helpful to patients when they see the before and after results, but it's still not their body, their face, their nose, their breast. And so with 3D imaging, we can create a simulation. It's not an exact, of course, translation into surgery, but it gives a good idea so that the patients can visualize what the might be the changes that we've been discussing, and they can weigh in on what they might like about it, what they might not like about it. And so it's a very useful tool.
Well, I thank you for visiting with me here today. And the other day I was looking at a photo of myself and I was dressed up as Cupid for Halloween. And you know, it's getting, while we're taping this, it's getting to be close to Valentine's Day. And I looked at who I was at that age, and I looked at who I am now. I can tell it's still me, but I was like, oh, even myself, I was like, you know, the angry 11s, the lines, it's aging, right? So even if somebody just needs a little tiny thing, they could come to you and you would work with them.
Well, absolutely.
Okay.
Absolutely.
A little minor here, a little minor there, but oh yeah, I miss those days. I also, my makeup artist told me today, she goes, you're not hydrating enough. So I know that people drink water, their skin naturally is going to be better. That's a quick fix, right?
Well, that's the easiest fix.
That's the easiest fix. Dr. Forley, thank you so much. Stay tuned for more. We've been living it up right here. I love to shine a light on different guests so that you yourself can see if maybe that would be a person that you'd like to work with. Stay tuned for more. Been living it up right here with Dr. Bryan Forley.